I am Dr. Ruto Parikh, working as an assistant professor at Ahmedabad Physiotherapy College. And today we are going to have a session on normal development red flags. So, starting with the introduction of Dr. Vivek sir. Dr. Vivek sir has done MPT in neurological condition from Government Physiotherapy College, Ahmedabad, under Gujarat University, and he is pursuing PhD from Gujarat University under the guidance of Dr. M. Prabhakar sir. He is currently working as assistant professor in physiotherapy at SPB College of Physiotherapy, Surat. He has previously worked as lecturer at Pioneer Physiotherapy College, Vadodara, and as senior lecturer and principal in charge at Satish Goswami College of Physiotherapy, Ahmedabad. He has more than 10 years of experience in the field of physiotherapy. He was rewarded the Research Excellence Award 2020 by Institute of Scholars at Bangalore recently. His research interest is in pediatric rehabilitation and family-centered care. He has several national and international publication presentations. He also served as a member of Executive Committee of Gujarat Physio Teachers Association. His students describe him as a very enthusiastic and passionate teacher. He describes complex things with that clinical relevance and makes it easy to understand and remember. So it is our privilege to have Dr. Vivek sir with us as a speaker. So here I welcome you, sir.
Thank you, Rupu ma'am, for the kind introduction. I hope I am audible to everybody.
Yes, sir, you are audible.
Yeah, okay. Uh, as you must be knowing that we will be dealing with developmental red flags, why they are there, and how we can identify them. So basically, uh, when we talk about pediatrics, we generally deal with the kids who are having diagnosis of various neurological and musculoskeletal conditions. But if we are trained, if our eyes are skilled enough to identify the red flags of developmental issues in early ages or stages of the development of child, and we can train or teach the parents to identify them, then it becomes easier to identify the upcoming disease or disability in a child, and we can start working early towards prevention as well as management of whatever damage has been done. So today's topic is important in the manner that we as a physio as well as our colleague team members from other fraternities who are dealing with the kids can definitely learn from this, and we can teach the parents so that we can prevent a life full of sufferings for a child. While beginning, we'll go through the outline of our today's topic. First, we will learn about background and overview of normal development up to 5 years of age. Then we will learn about the definition and meaning of red flags. Then after that, we will learn about the significance of identification of developmental red flags, how we can identify the developmental red flags, and how we can use play for stimulating development in the child. As we know, development of child can be defined as a process by which a child changes over time. It starts from conception and ends when a child is developed into fully functioning adult. It incorporates multiple aspects such as physical growth, intellectual language, emotional and social development. Developmental milestones, on the other hand, are age specific tasks which children attain at certain age and are commonly studied, divided into the branches such as gross motor, fine motor, language, and social skills. Now, what is developmental delay? When we talk of the development and normal development, we also have to define when we can say the development is delayed. So, as per the definition of developmental delay in India, any delay in gross motor, fine motor, speech, language, cognitive and social, hearing, and vision domain in a young child's development as compared to other children is called developmental delay. These are the major aspects. And when there is delay in one area of the development, in India it is known as focal delay. But when there is delay in more than one area, it is known as global developmental delay. Now we'll know some facts and figures. Globally, there are 250 million children under the age of 5 years which are susceptible to delay in their developmental years, which is approximately 43%. But in India, nearly 10% of all the children in early childhood are the culprits of developmental delay. If you look at the distribution of delay, motor delay accounts for 5 to 6%, 5.4 to 6.3%. Amongst these 10% of all the children, hearing impairments account for 5.4%, cognitive delay 4.79%, visual impairments 5 to 10%, and speech and language in 5 to 8% of children are delayed. As we said that we will go briefly learning about the developmental milestones. Now, first during 0 to 6 months, that from birth to 6 months, the child develops passes through various stages such as supported standing and automatic stepping reaction, grasp reflex, supported seating, where the child can focus for a short period towards the object which is auditory or visually attractive. The child can then gradually learn to come into the midline with using his hands and legs. He can see the legs movement and play involving the upper extremities and lower extremities in the midline. The child then focuses on the sound when he or she is called from somewhere, can sit in supported round sitting. The trunk is still not erect. He or she can come onto pronon hands and extends the trunk and can stand in supported standing at the end of 6 months. This is a process. Everything goes in sequence. After that, during 6 to 12 months, the child can play with the toy in hand. He or she can grasp the object or a cube with palmar grasp, can play using both the hands, which is called bilateral manipulation. He or she can imitate ringing the bell once we show the child that how the how the ringing of bell is done. The child can imitate us. He or she can stand up with support, can use finer grasp, pincer grasp for holding the beads, and can involve in communication using play activities with an adult. During 12 to 18 months, the child starts to bear walk initially, then can walk with one arm held. The child can imitate the activities of daily living, such as combing hair or brushing the teeth. He or she can hold the arm extended or can extend the legs so that he or she is helpful in clothing. The child learns to draw lines using a gross grip of the pencil. There is no exact meaning of the lines, but the child starts to hold the pencil. and gradually wide base and high arm gait is seen. A child can now make building of blocks 2 or 3 blocks and can walk with support pushing a wheel cart. During 18 to 24 months, the child can descend stairs with arm held. He or she starts taking interest in the storybooks having pictures, can play with the cubes or small objects. He can fill the larger ball or cups with the objects and can empty and starts imitating daily activities such as cleaning with the broom, starts exploring the objects within the easy reach. Now at 2 to 3 years, the child can jump from the lower steps, but he or she keeps both the feet together. He can start the writing or imitating the writing of VYW, and it becomes risky for the child because the child's exploratory activities are increased. The child does not know about the risk, and that is why we have to keep much care. During 3 to 4 years of age, the child can now use the stairs ascending and descending just by holding the side railing. The child can use blocks play and make tower of threes or more. He or she can play using smaller toys and can start imaginary play using smaller toys which he or she is having as a part of a story. Now he or she can pull the lower clothing such as tights or the shorts or pants. At 4 to 5 years of age, the child can now independently descend the stair, that to alternate steps, can stand in one leg standing position with arm crossed across the chest, can imitate the adults like this kid, this girl is has prepared herself like a fashionista and can imitate small shapes such as circles, cross, squares, triangles, but the lines are not exactly what we are supposed to draw, and can engage in imitating play such as આપણે રૂટીનમાં એમ કહે છે ઘર ઘર રમવું બરાબર. Then the child starts imitating, one is a father, one is a mother, one is going to office and all these things. They can start playing teacher and a student or a doctor and a patient, kind of imitating play where more 2 or more kids are involved, that is peer play. He or she starts using the objects like an instrument of profession. Now this was brief about the development milestones of the development. Now what are the red flags? Red, as we all know, is an indication of danger. Whenever there is danger, we indicate that danger via red color. Definition of red flag according to Merriam-Webster dictionary is something which indicates or draws attention to a problem or danger or irregularity. So what we are looking is irregularity in the development, and because of that, problem or danger to the child's normal development. What are developmental red flags? They are the most common presentation of developmental disability. It is because of the failure to achieve age-appropriate developmental milestones. The child cannot achieve age-appropriate milestones. We can say that developmental red flag when there is a child's failure to reach speech and language milestone. It does not necessarily mean that there is a problem. We cannot say just the child is walking fine, the child is sitting fine. But if there is delay or there is an issue which you notice in the speech and language milestones, it is also called red flag, or it is a warning sign. But if the child does not attain the milestone at age, then there is not necessary always a problem. So we have to refer and we have to get the child evaluated by the health professional. A single red flag is not always an indication for concern or referral. So whenever we start to doubt that there is a red flag which can affect the child's development and it has to be intervened, then we have to discuss the condition with the parents or carers of the child and then further refer and evaluate the child. Now, what is the significance of developmental red flags? First, we can do early referral to expert consultants for further decision and management. We can assist early identification of developmental concerns in child's developmental domains, which we have already discussed. We can assist with clinical decision making when we use these red flags in conjunction with other evidence-based screening tools, and we can facilitate conversation with parents or carers. When we want to talk with them, we want to explain them about the situation, the risk factors, and how we are going to plan. We can use these red flags so that the benefits of early identification and intervention can be easily explained to them. Now, what is delay and what is deviance? As we know, deviance, first we will learn about deviance. If the child is not able to maintain the course of development in the prescribed fashion or a manner which is considered normal, there is deviation from the pathway. The child can learn to stand, but the standing is not proper. The standing is not as good as the normal child should have, then it is called deviance. But that is in the manner or pattern of the quality. But if the child is not able to attain standing at the age when it should have achieved the standing, then it is called delay. At 1 year, if the child is supposed to have supported standing and he or she achieves it at 1.5 years, then it is called delay. But if at 1 year the child can stand with support, but there is deviation in the posture, there is deviation in the pattern when the child comes from sitting to standing, it is called deviance. What is screening and what is surveillance? When we deal with the kids continuously in the field, then we come across such terminologies. Now, in simple terms, screening is just one-time visit and observing or evaluating the child for finding out the developmental issues. That is screening. That is just once time. Everybody must be familiar with the terms of research methodology. So screening is kind of cross-sectional study. Where is surveillance? Surveillance is when we evaluate the child once and then we take follow-up after 3 months or 6 months and a year and a 5-year duration. Then it is called surveillance. Continuously taking follow-up of the child who was suspected as developmental delayed child and then how he or she has been helped with the treatment. So long-term follow-up is surveillance. One-time cross-sectional studying is screening. Now, what are the streams of development which we considered? First is gross motor, where we consider rolling and head holding and standing and sitting and crawling, running, jumping, these kind of activities. Fine motor is use of the hands and fingers for various grasp and use of them for the play activities. Language, that is expressive or receptive language, when the child is not able to understand, then we have to identify why the child is having this kind of receptive issues. And when the child is not able to express through speech or expressions, then we have to identify why there are expressive language issues. Next is problem solving, simple to complex problems. As when the child is growing, initially simple problems are easily solved by them. But once the child grows up, the complexity of problems which he or she can solve is increased. If the child is not keeping up with the expected norms, then we have to ask. Next is social. Social involvement of the child has also should also be seen while considering the developmental red flags, such as smiling or getting involved in the play with the peer, or trying to get attention from the adults, trying to communicate with the adults. Now, what are the ages for early diagnosis of variety of developmental issues? During first 12 months or 1 year, we can identify intellectual disabilities which are moderate to severe in nature, visual and hearing impairments, and cerebral palsy. After that, during 1 to 2 years of age, we can identify moderate intellectual disabilities, hearing impairments, cerebral palsy, and autism. During 2 to 3 years of age, mild intellectual disabilities, hearing impairment, mild CP, and autism or learning disabilities can be identified. And after that, during 3 to 5 years of age, mild intellectual disabilities and learning disabilities can be identified. So this is relevant because we cannot expect to know if there is learning disability in a 1 or 2 year old child, because he or she is not getting involved in such kind of learning activities where we can judge. Now, gross motor red flags for up to 6 months age. If the child is not holding head and shoulders up with good control while lying on tummy, that is in prone lying, and is not holding head with control in supported sitting, then we can consider these things as red flags. If they are present, then we have to check, we have to evaluate. After 6 months and up to 9 months, if the child is not rolling, not sitting independently without support, not moving in creeping or crawling, and not taking weight on legs when held in standing, then we can say the child is having suspected developmental delay. During the phase of 9 to 12 months, there is no independent mobility such as crawling, commando crawling, or bottom shuffling. The child is not pulling to stand independently and holding on for support. During 18 months, the child is not standing independently and not attempting to walk without support. Up to 2 years, not able to walk independently, not able to walk up and down stairs, holding on the side support or rail. And after 3 years, up to 3 years, if the child is not able to walk up and down stairs independently, not able to run or jump. At 4 years of age, if the child is not able to walk, run, climb, jump, and use the stairs confidently, and not able to catch, throw, or kick a ball. At 5 years, not able to walk, run, climb, jump, and use stairs confidently, and not able to hop 5 times on one leg and stand on one leg for at least 5 seconds. So I went through these gross motor red flags fast. We are almost familiar with this kind of their developmental stages. At 1 year, the child should be standing with support. At 1.5 years, independent standing. At 2 years, walking independently without any kind of support or guard needed. So if this is how the red flags are defined. If at certain age, the child is not able to attain the milestone plus or minus. At 1 year of age, if the child is not able to stand with support, then directly we cannot call it a red flag. We have to keep it in suspicion. But if at 1.5 years of age even the child is not standing with support, then we have to consider it a definite red flag. So there is a margin of benefit of doubt where we allow child to develop slowly, but not beyond the certain limit. So if these kind of deficiencies in gross motor milestones or development is present, then we definitely consider it as red flag. If at 4 years of age child is not standing or walking independently, then definitely it is a delay case, right? Same way for cognition, fine motor and self-care. At 6 months, the child is not reaching and not holding the toys. The hands are clenched frequently, does not explore objects with hand, eye, and mouth, does not bring hands together at midline. We saw in that picture during the developmental normal development phase, the child starts bringing hands at midline before 6 months of age. At 9 months, if child is not holding the objects and cannot give objects on request, release of objects is not there, or cannot move toy from one hand to another, that is bilateral play. At 12 months, the child does not feed self, finger food, or hold own bottle cup. Unable to pick up small items with use of index, finger, and thumb. That is, we are gradually going towards the finer grips. At 18 months, does not scribble with a crayon, does not attempt to stack blocks after demonstration. He or she cannot follow, cannot imitate our block game. At 2 years, the child does not attempt to feed self using a spoon and cannot help with dressing, such as holding out the arms or keeping the legs straight. At 3 years, the child does not attempt everyday self care skills such as feeding or dressing and is having difficulty in manipulation of the small objects such as threading of the beads. At 4 years, daytime toilet training is not there and is not able to draw lines and circle. At 5 years, the child is not able to independently complete every routine such as feeding and dressing and is still not able to draw simple pictures such as a stick diagram of a person. So these are the cognition, fine motor and self-care related red flags. Now we'll look into the communication red flags. If at 6 months child does not start to babble such as oo kind of sounds, at 9 months the child is not using gestures such as pointing, showing, waving, and not using two-part babbles or bisyllables, boo boo, dada, mama, kaka, like sounds. At 12 months, no babbled phrases which are sounding like talking, because at this point of time, after observation of adults which are talking in front of them, the child starts to imitate talking. They are not providing any meaning with their talk, but they provide sound modulations. They babble and act like they are talking. Okay? And if there is no response to familiar words such as bottle or daddy or food or dress, wawa, like this, we use many words up to the age of 1 year in front of child. And still, if the child is not responding to the familiar words, then it is definitely a red flag. At 18 months, the child is not speaking clear words and is not able to understand short questions or requests. Where is the ball? Give me the ball. Please hold this object or toy. Take this toy. Like these are the short requests. These are the short commands which the child should be able to understand and follow. At 2 years, the child is not able to learn new words and he is not able to put two words together and make small sentences. Push car, pull the cart, drink water. Write this kind of small sentences. If the child is not able to make, then it is a red flag. At 3 years, the speech is difficult for familiar people to understand. Now, it is definitely for a 3-year-old child when he or she is talking, the unfamiliar person who are coming first time or rarely in contact with the child, it is not easy for them to understand what child is saying or is want to convey to them. But if a familiar person cannot understand the things, then definitely it is a red flag. And if the child is not able to use simple sentences such as big cargo, મોટી ગાડી જાય છે, હાથી જાડો હાથી આવે છે, like this kind of thing. At 4 years, the speech is difficult to understand and the child is not able to follow directions with 2 steps. Put your bag away and then go play. તારી બેગ મૂકી અને રમ. બે commands થયા, but the child is not able to understand and follow the directions. 5 years, the child is not able to or is having difficulty in explaining the parents what is wrong or is not able to answer questions while we are having a simple conversation. What is your name? Where do you live? In which standard do you study? Like these are the simple questions. If he or she is not able to answer such simple conversational questions, then it is considered as a red